also call it as Crimean Congo hemorrhagic fever virus. Now let's come towards the pathogenesis of the virus, how this virus is causing the hemorrhage, or how this virus is causing the severe type of bleeding. The pathogenesis of this particular virus. Now what is the pathogenesis? Simple. Is this virus Congo virus, or you can also call it as CHFV virus or CHFV virus. When this Congo virus actually enters inside the body and it gets its way into the cell, it will start replicating itself. Means it will start making its copies. As it makes its copies, then it will cause the body to generate a kind of immune response. This is very common. When something enters our body will generate immune response. Okay, this is our responsibility, the responsibility of our body to generate an immune response in order to protect our body from this particular virus, bacteria, or anything that is coming to the body, that is invading our cells. Okay, so our cells are supposed to be protected because of this immune response. Our immunity, our defense mechanism, our army is supposed to fight against this particular virus. So what is happening then is this virus enters inside the cells and it replicates itself and it starts making its copies, and then in the meanwhile there is immune response being generated, and if the virus is having enough strength, this virus will cause the destruction of the endothelial cells of the blood vessels. Here we have our blood vessel, which is a normal blood vessel. What is supposed to happen? The blood is supposed to flow inside this blood vessel. When this virus actually enters inside the body and the cells, so the endothelial cells of this blood vessels, they are actually a kind of damaged. So what will happen there? Due to that damage, the endothelial cells will no more be available, and due to which what will happen? Small pores will be actually seen in the endothelials, in the blood vessels, and from which the blood will start moving out. So it is actually making the vessel leak. So from the leak vessel, what's supposed to happen? Simple. A vessel is leaked, so the blood is no more able to move through the vessel. Otherwise, it will actually start moving from the vessel outside, away from the pores. So now blood is no more available in the blood vessel. Now it is moving outside from the blood vessels. Okay. So what will happen then? Then the hemorrhage will be seen. Hemorrhage means several type of bleeding will be seen. This is how bleeding is caused actually. And in the meanwhile, you might have heard that there is actually decrease in platelets count in the patients. Now how that is actually caused?